Well, of course, this morning we do want to start out, though, talking about our health, and specifically a health issue many of us may face in our lifetime as we get older, something that can be painful, look horrible, and in some cases can even cause permanent nerve damage.
Wow. Well, it's a disease. However, it can almost always be prevented with immunization, and it's called shingles.
That's right. The vaccine, though, isn't one that we give to our kids. It's for adults as we get older. And the good news here, it's available at our neighborhood Meijer Pharmacy. Well, today we're talking about a really important health issue that especially will be facing us as we get older. We're talking shingles today, and we're here at Meijer, this beautiful pharmacy location in Cedar Springs with Effie Steele. You're the clinical coordinator for all of the Meijer Corporation. You're our partners really in healthcare, and that's why you invest so fully in this kind of a great patient care setup. Tell me about that.
Well, we do. We believe in preventive health care as part of the pharmacy model. So all our pharmacists are trained in health screening and in immunizations and in extensive comprehensive medical reviews. And as part of the immunizations, we want to talk about shingles today because it's so important and it can be devastating.
Tell me about shingles, because I hear this. Is it loosely related to chicken pox?
It is, and people get a little confused as to why. And the fact is, if you've had chicken pox, you are at higher risk of shingles. So pretty much 90% of the population that is over the age of 15 is at risk for shingles. And your risk increases as you get older. So at age 60, your risk is 1 in 3. At age 80, it's 1 in 2.
Wow.
Yeah.
So those are pretty interesting statistics that we all really are going to have to take notice of, especially as we age. Tell me about shingles. Exactly what does it do to your body? Is it painful?
It is extremely painful because what happens with the virus is it goes dormant in your spinal column, and as you become immune suppressed, it can rear its ugly head anywhere on your body where you have nerve endings. The most typical places are around your belt line. That's why it's called the zoster. It can also travel down your neck and very typically on your face, and it's generally one-sided, but you can first experience symptoms with the pain, tingling, numbness, but some patients only experience severe pain, and it can result in hospitalization with physicians trying to find out what's wrong with the patient, only to find out days later when the blisters come that they have shingles.
Yeah, and the pictures look like it can be just excruciating, the pain associated with having an outbreak of shingles.
It is, and typical pain medication doesn't really help this kind of pain because it's neurologic pain. So at that point, our defenses are things like lidocaine patches that can be applied locally on the site, or anti-convulsion medication, which fools your body into thinking that it has less pain, but really sometimes I've talked to patients that none of that was masking how horrible the pain was.
Okay, so tell me about preventing this, because it sounds like your best odds in treating shingles is to never get it in the first place.
Yes, it's called one word, vaccine. Please, everyone who is listening, if you are at risk, it's so smart. Please help yourself and get vaccinated. The Zostavax vaccine is available at all our Meijer pharmacies, and our pharmacists are fully certified, nationally certified, and trained to provide you with the vaccine. So please, please do yourself a favor.
It's a one-shot deal.
One time, once in a lifetime, and that's it.
So you offer the immunizations here at Meijer. Where do you do that?
We do. Well, typically we prefer privacy, and as you can see, we're standing in front of one of our private consultation rooms at the Cedar Springs store. So we would want to do it in complete privacy.
So you have a place where people can know that their patient confidentiality is protected.
Exactly.
And you have that one-on-one access with your trained pharmacist.
Absolutely, and that's the way we'd like to keep it.
Fantastic. Well, thank you so much, Effie.
Thanks.
And remember, your partners in healthcare, your neighborhood Meijer.
You know, one of my good friends just got shingles.
Oh, you're kidding.
No, and I saw it on her back. We didn't know what it was. We thought it was a rash, and it's actually very painful.
How old is she?
She's about 49.
Wow.
She went into the doctor, sure enough, shingles.
Just amazing.
Yeah.
And you know what? Like you said, it's so painful. Those pictures, I mean, it's difficult to look at them and very painful. It's very difficult because you think that as you get older, your chances of getting some of these diseases get less, but with shingles, as you age, the odds of you actually contracting shingles gets higher. And any of us who have ever been exposed to the chicken pox or have had chicken pox are at risk for getting it. So after age 50, you should consider getting that shingles vaccine. And as part of a comprehensive focus on becoming our partners in healthy living, every single Meijer Pharmacy has trained staff, trained people on staff to give you the shingles vaccine. It's probably best to call, though, before you head to the pharmacy.
That's right. Well, as far as cost, it's covered under Medical Part D, but there are some insurance companies that do cover it, but otherwise the cost is about $210.
The best thing to do is stop by your neighborhood pharmacy at Meijer and ask them. They'll be able to check out, figure out what your insurance may pay, and otherwise just a really great example of something that prevents a huge disease that can come later in life.
Right, and $210 is nothing compared to the
suffering
and the suffering.
That's
Absolutely.
right. Hospitalization even can come with some of the more advanced cases of shingles. You don't want to get it.
You don't.
Bottom line.